Taiwan confirmed its 9th case of a new coronavirus on Thursday. Taiwan Centers for Disease Control says the patient was infected by her husband, who had returned to Taiwan from working in the Chinese city of Wuhan. The man had presented cold symptoms, but no fever. The Central Epidemic Command Center has announced that it will requisition all face masks produced domestically starting Friday to ensure a stable supply.
我们先宣布一个，我们第九例的确诊个案。
A 9th case of novel coronavirus infection has been confirmed in Taiwan. Just like the 8th case, this patient contracted the virus from a family member.
他的先生是在武汉工作。
Her husband works in Wuhan. When he came back, he had a bit of a cold and a cough and recovered very quickly. That's how his wife was infected. So it's been determined that this was a case of household transmission. In the future, there will be a certain percentage of people who become infected but present no symptoms.
Amid the expanding outbreak, the Central Epidemic Command Center has announced it will requisition medical face masks produced by domestic manufacturers starting Friday. Each day, the government will release 2.6 million masks into the market for the public. An additional 1.4 million masks will be allocated daily for medical or government uses.
我们就决定对于口罩。
We decided to requisition and regulate the entire supply of face masks. In other words, the government will acquire all face masks and distribute them appropriately and control their price. We will strive to purchase them at a reasonable price.
如果一般健康的人
People in good health who don't have any respiratory problems or fever can continue their lives as usual. They should take the proper precautions, but they don't necessarily need to wear a face mask.
Vice President Chen Chien-jen, who's an epidemiologist by training, called for calm amid the run on face masks. He stressed that face masks were only recommended for healthcare and disease prevention personnel, workers in enclosed spaces, and people in public spaces. He said the rest of the public should not be overly fearful over catching the virus.